Nobody knows what's in it, and even if they do, they have no idea how it's going to affect all of our coverage. I think everybody's feeling very anxious about the whole thing.
So you thought for the better part of valor, get the treatment, everything you can, as aggressive as you can now, because later you're not so sure?
Absolutely.
Wow.
Absolutely. I'm getting terrific care, and I'm grateful that they are able to give me the best care they have because my insurance right now is covering it. Who knows what the future holds?
Man, the email we got on that one, her name is Cindy. She didn't want us to use her last name out of fear of retribution. She is fighting breast cancer. Is thankful she has her cancer now, though, because of the rationing she fears is ahead. Her insurance company, United Healthcare, announcing a cost-cutting pilot program for cancer treatments, and that really worried her. Now, Ben, you've been warning what this woman has been fearing, huh?
Well, there's never been a case that I'm aware of where there's been a government-run health care where there isn't some kind of rationing. The government, to be fair, just doesn't have the money to pay for unlimited health care for everyone. There's going to be rationing, and some people are going to get inadequate health care and will die. In a way, you might say, well, poor people have had rationing forever. Now it's going to be spread around. But in the end, only the rich are going to be able to get unlimited medical care.
But Adam, what do you think of the view that this woman had that I'm grateful I have my cancer now?
It's not necessarily an informed opinion. She's great. She should be grateful. She has good insurance now, but we have to remind ourselves every time, Ben, insurance equals rationing. It's always been the case, and it always will be the case. That's not changing.
Do you want government to decide what kind of care you get? Because that's what's going to happen. Medicare, there has to be...
Do you want United Healthcare deciding? I'm not sure which is worse,
me and my insurer make that decision rather than somebody in government, and the Medicare pilot programs that are going to be put in place with this health care law to decide quality over quantity. Somebody in government gets to make that decision.
All right, by the way, I was furious about this story until I discovered that United Healthcare is indeed my health insurer. So we decided to call them up and find out their point of view on this. And they said, putting out a statement, that the intent of the pilot is to identify and reduce unnecessary drug administration that does not improve the patient's health outcomes. But again, that did raise fears that either now or later something gets rationed.
It's common sense. First of all, countries with socialized medicine, the wait times are legendary. People dying waiting for things that we get here in weeks in America. We're going to add millions of people to this program and not expect there to be incredible problems. I've read where, and I've heard that there's going to be at least 90,000 doctors short. So that means nurses are going to do things that trained doctors are supposed to do, and people are just going to get a lot less. It's not well thought out, it's going to be expensive, and it's going to be a disaster.
All right, on that upbeat note, gridlock coming to Washington. Is it good for your wallet? Yeah, our gang says a whole group of stocks will go up, if nothing, when the Capitol goes down.